Hi, my name is Shelley Looning and I'm the owner and founder of NCLEX Education. Thanks for taking time to listen to this video. I'd like to just go over a few things about our program, and then if you have questions, we're always more than welcome to answer any questions you might have. So there's 3 parts to our program. The first is their self-paced modules. We find this very convenient for students and nurses who are working or going to school, so you have the time to work through these modules at your own pace. So the first online module that we have is called the foundational section. What I've done in this section is actually broke this into systems. So you will get a list of all the systems and all of the diseases on the NCLEX in each system. This is one of the only programs that does that, where we list all the diseases that are on the NCLEX. We teach you how to study that differently than you have. So we really want you to build on what you already know and to really learn and understand versus memorize. We know that we can get into a trap of memorizing things. We just really want you to learn and understand that material. And then what we do is we actually test that with CAT questions. So CAT, or the computer adaptive testing, where depending on how you answer will depend on the question you get next. So just like the NCLEX. So every student will do a different amount of questions and different questions depending on their learning needs. So we go through that first section by system. So for example, you would get respiratory, a list of all the diseases on the NCLEX, and then you would study those and do those questions until you're really confident. And we actually get students to a really high mastery level. So we make sure that you are going to 100% pass that NCLEX. Once you've mastered that section, you would go on to the next system, which would be cardio. So that's how that first self-paced module works. The second self-paced module is the pharmacology module. We find that students often stress about pharm, they worry about it, and there's a lot to pharmacology on this NCLEX exam. So we want to make sure that you're fully prepared for that. So what we do is we give you a list of all the possible drugs that could be on the NCLEX, and we again teach you how to study it a bit different than you might be used to. We then again test it with those CAT questions to ensure you know and have that knowledge prior to moving to the next module. The last module we have is called the client needs module. That module is actually the framework in what the NCLEX is based on. So we go through each of the categories that are on the NCLEX, make sure you have a really good understanding of what each section entails, how to conquer that section, give you all sorts of cheat sheets, resources, tips and tricks for each of the sections, and then again, test it with those CAT questions to ensure that you do have a really good understanding of that material and that content prior to moving on. So those 3 self-paced modules you can work at, like I said, at whatever pace you like, and work through, take your time, or you can, do it full time if you'd like as a student. The second part to our program is we actually have live online sessions. So these live online sessions are with master's prepared faculty nurse educators. So these nurse educators will take you through an algorithm that we've built to help you learn how to interpret questions. NCLEX questions can be extremely confusing, not understanding what they're exactly asking. And so what we do is we break that down for you, and we teach you a way to approach those questions so that each and every time you know what it's asking and you have a better chance of getting that question correct. Oftentimes I see students that have all the content knowledge in the world, but they actually cannot read that question clearly and therefore don't get it correct. And so we want to make sure that that isn't you, and we really work on learning how to read that question appropriately. The last section of the exam is we actually have unlimited NCLEX exams, and there's 2 types of exams. So one is a comprehensive exam, where it actually will have you practice a short exam, maybe a 75 question exam, a long exam, 145 question exam, and a whole bunch of lengths in between. We do this so that you have a really good feeling of what is it like to practice exams prior to taking the real one. We also have mock exams, and they shut off when you've passed or failed, just like the NCLEX. So we feel it's really important that you do a lot of exams prior to taking your real exam. So we have unlimited exams, and we do encourage within our program that students take a minimum of 12 exams. And what we do with all of that is you are paired with an NCLEX faculty coach mentor that can help walk you through the entire program. And this coach will go through all of your exams, all of your questions in the program, and come up with some extra assignments and resources and things that are geared for you. So they find where those gaps and weaknesses might be for you and give you the tools you need to succeed and overcome those gaps and weaknesses. So it's really, really tailored to fit you as a learner so that you are working on exactly what you need to work on. So you will be partnered with an NCLEX coach mentor in our faculty facilitated program that you can reach out to by email. They're there to answer all of your questions throughout the program. So we really want you to succeed. We want to walk with you hand in hand to the end till you get that RN behind your name. I hope this was helpful in explaining a little bit more about what our program is about. If you have any questions still or would like to follow up with a 15-minute free phone call, we're always happy to do that. Thanks so much and good luck.